Are you low on energy? Well, that's an easy fix. All you have to do is take this vitamin B12 supplement and all of your energy problems will be solved. Catching my sarcasm here? It's vague marketing claims just like that one that has made vitamin B12 one of the more popular vitamins that people actually take. The question is, can you take too much of it? Are there any side effects? I'm gonna cover that and more in today's video. And as always, for the best nutrition, health, and fitness advice, make sure you subscribe to my channel and hit that little notification bell so that you're notified every time I post a new video every Wednesday. Is vitamin B12 deficiency a real thing? Yes, definitely. Do some people need to utilize vitamin B12 as a supplement for them specifically? 100%. In this video, I'm gonna explain to you the reasons why you may not wanna reach for that vitamin B12 bottle every single day, and why you may not wanna run off to the doctor to get a vitamin B12 shot every time you think that you're a little bit low on energy. And make sure that you stick around to the end of the video where I'm going to give you 2 specific blood tests that you would need to verify if you actually have a vitamin B12 deficiency. First off, why do we want B12 in our diets? Well, a B12 deficiency can lead to multiple different things. It can be visual disturbances, you can have peripheral nerve issues, you can have exercise intolerance, shortness of breath, it can cause dizziness upon standing, and this is just to name a few things that can happen if you don't have enough B12 in your diet. I know that a lot of people out there assume that if you take too much of a vitamin or mineral, that your body recognizes that it's a vitamin or mineral and it just excretes whatever it doesn't need. I wish this was true, but unfortunately it's not. People are like, well, it's a vitamin, it's a mineral, it can't possibly be bad for you. Not the case. There are several vitamins and minerals that can definitely have some issues if you take too much of it. Too much vitamin A in your diet could potentially cause organ damage. Too much vitamin C can lead to you having kidney stones. Too much zinc can actually weaken your immune system and cause a deficiency in your copper. And that's just to name a few things. While we do want to make sure that we are getting an adequate amount of vitamins and minerals in our diet, we definitely want to make sure that we're paying attention that we are not over supplementing with vitamins and minerals, especially the ones that can potentially have negative side effects. Question for you. Are you taking a B12 supplement now? B12 by itself, maybe B12 that's in a multivitamin, something along those lines. Are you taking it? And if so, how much are you taking on average? Let me know below in the comments as I'm curious to hear everybody's feedback on this. So what happens if we get too much B12 from supplementation? There are 3 specific studies that I want to reference in today's video and kind of help give you an understanding of why you may want to pay attention to the amount of vitamin B12 that you're taking and make sure that you actually need it before you start supplementing with it. The first study that I want to talk about was published in the Journal of Clinical Oncology. And what the researchers found is they gave high doses of vitamin B6 and high doses of vitamin B12 specifically to the people involved in the research study. And they found that it had potentially several negative side effects, but the biggest impact that they found specifically was on lung cancer. And what they found was that this tripled or potentially even quadrupled your risk of lung cancer from having too much vitamin B6 and B12 in your diet. Also, in 2009, in the Journal of American Medical Association, they found that taking higher doses of B12 and folate, or essentially vitamin B9, led to the increased risk of multiple types of cancers, as well as just an all-around increase in mortality. And the third study that I want to discuss was in 2013, and it was in the Journal of the National Cancer Institute. And in this study specifically, when they started it, the people that were involved in the study did not have cancer. And they did have them all tested for their vitamin B12 status at that time. And what they found was that the people that had the highest vitamin B12 status also had the highest incidence of getting cancer, specifically in the first year after being tested and showing the high vitamin B12 levels in the blood. Now here's the thing, most of these studies don't actually point at specific causation, saying that if you have high vitamin B12, that it's gonna give you cancer. Most of this is just correlation, and we all understand, hopefully, that correlation does not equal causation. Just because something is related doesn't mean that it's a definitive cause of that. But that also doesn't mean that we should just ignore these studies either. The main thing that I'm trying to get a point across is that I want people to understand that B12 is just thrown out there like it's not a big deal. Take the supplement, go take the shot. Most of this is done without really ever knowing if you actually need more vitamin B12. And finding out if you need more vitamin B12 is very, very simple. Knowing that there are multiple studies out there that are showing a correlation between high vitamin B12 levels and different types of cancer, then why risk it? Why not know for sure that you need the vitamin B12 before you worry about supplementation? Or if you do supplement it with it more in the short term instead of the long term, and verify this through blood work. There was a quote specifically from the National Institute of Health, and they stated that vitamin B12 supplementation seemed to have no beneficial effect on performance in the absence of a nutritional deficit. So basically what they're saying here is that if you don't need vitamin B12, if you are not deficient in vitamin B12, that supplementing with it didn't show any increases in performance. So a lot of the times in these situations, why take the risk of supplementing and taking more vitamin B12 if you can verify that you do not need it? Where do we go from here? We need to be able to confirm that you have a vitamin B12 deficiency before you worry about supplementing with it or getting any type of injections of vitamin B12 or anything along those lines if it's something you're considering doing. Finding this out is relatively easy, and it really only takes 2 tests. The first one, of course, is going to be checking vitamin B12 levels in the blood. That's obviously a really good start. How much vitamin B12 do you have in your blood? Are you deficient? Are you in the right range? Do you have too much? That's the first one. Then from there, there's a secondary test that helps us to understand things a little bit better. And this specific test, basically what it tells us is if the B12 is getting into the cell and doing its job. Just because you have a specific vitamin, nutrient, or anything that's in your blood, it doesn't do any good in your blood. That specific nutrient needs to get into the cell in order to be able to do its job. So verifying that you have the right levels that are in your blood is great, but we also want to be able to verify that it's actually getting into the cell and being utilized. And this test is called methylmalonic acid. Having this tested specifically will let you know if you are getting the vitamin B12 in your cells. If you have any type of a deficiency, what you'll find is that the methylmalonic acid will actually be increased, it will be raised. If it's at more of a normal level, a little bit lower level, then the B12 is more than likely getting into the cells and doing its job. B12 on its own is an essential nutrient, and we do need to make sure that we are getting enough of it from our diet. It is very important as deficiencies can cause problems. But at the same time, we want to make sure that we are not getting too much vitamin B12, as there are multiple correlations potentially to increased cancer risk. The overall theme here is make sure that you need the vitamin B12 before you just start supplementing with a lot of it, thinking that there aren't any negative side effects because it's just a vitamin and it can't possibly be bad for you. If you enjoyed this video, I would appreciate it if you would smash that like button and make sure to subscribe to the channel. I'll see you guys in the next video.